just before Christmas last year, the Duke of Edinburgh had treatment for a blocked coronary artery. Let's speak to Dr. Iqbal Malik, a consultant cardiologist at Hammersmith Hospital. Thank you for coming in. We have no idea what is wrong with the Prince at the moment. We know that he was taken to hospital by ambulance, which would suggest, would it to you, that potentially this wasn't a critical event this afternoon?
So I think he was taken to hospital by car rather than ambulance.
We've now heard
by
it's ambulance, yeah.
Oh, okay. Well, if it's by ambulance, then that's not unusual for any health problem, but actually does make me slightly more concerned than I was earlier on when I heard it was by car, that perhaps it may be something to do with the heart. Obviously, once you've had heart problems, then any twinge anywhere between your chin and your belly button could be the heart, and therefore should be taken seriously.
He had the stent fitted last December. How much does that complicate or weaken his health, especially in a man this age?
Stents can produce a complete recovery if there's a blockage in one of the blood vessels and that's been treated with the stent to open the arteries up again. That can return you back to exactly the level you were at. And I think the suspicion we all have, although we don't have the exact details, is that the episode in December, if indeed it was a heart attack, was quite a small heart attack, given he made quite a rapid recovery for someone who's 91. So it would have left him back in about the same state he was in prior to the event.
And for a urinary infection, presumably something like that, I know that's not your area of speciality, but this is something quite common in elderly people and difficult to shake off the older you get?
I think if there's something underlying as a cause for the urinary infection, of course it can be difficult. It could be a stone, or it could be something in the bladder itself. Perhaps things aren't working quite as well as they were. In that situation, then things can be recurrent. And if you get a bad infection, it's much better to actually have treatment aggressively right at the start. That can alleviate problems in the future.
OK, Dr. Iqbal Malik, thank you very much indeed for coming to talk to us this afternoon.